well. So there's been a lot of buzz over the show 13 Reasons Why on Netflix, and the series deals with a lot of really heavy issues concerning multiple issues. It revolves around suicide, but it also deals with bullying, it deals with sexual assault, and again, all revolves around suicide. So there's been a lot of controversy on the series, and before we get into the next conversation, I just want to let you all know that if you or anyone you know needs to talk to someone or needs help, we do have information and the number to the National Suicide Prevention Lifeline on our Facebook page right now. So to talk about 13 Reasons Why and get into this discussion about teen suicide prevention, and more, I'd like to welcome Leigh Reposa. She's a licensed and independent clinical social worker and program manager for Rhode Island Youth Suicide Prevention Program. I wanted to get all that in there. Hi, Leigh. How are you?
Good. How are you, Molly?
Good. Thank you so much for joining us. Come on in. So a lot of buzz around this show, 13 Reasons Why, a lot of conversations happening about it nationally, locally. In fact, we were all just talking about it in the green room with our last guest. So let's get into the conversation about this series, and then we'll talk a little bit about a lot of the work that you're doing. We both watched this series. We've been having conversation over the past week about it. Tell me a little bit about your thoughts on the show.
My thoughts on the series, and first of all, I'm just so glad that someone locally actually contacted us and said that they were interested in our reaction. And when I say our, it's it's both a professional and a community effort around youth suicide prevention in Rhode Island. So there's a lot of different strategies that we have nationally, and then that drill down to the state level that I'm sure we'll probably talk a little bit about. But your question is how we really react to that in the field. And I think that there have been a number of different ways that people have reacted, both if they're parents, educators, as a clinician, somebody that works in schools. But I think that it's just given an opportunity and a voice to a topic that historically was probably pretty uncomfortable for, I know, parents and definitely for educators to even start. But the reality is that our students and our children and our adolescents are already having these conversations. So I think this really brings it to the forefront and actually kind of nudges the adults in kids' lives to have a conversation. And so we'll talk a little bit more about what that can look like and tips for parents.
Good. Yeah, and that's exactly it, that this is happening out there. People are having these conversations. Yes. It is uncomfortable. It's difficult. People in media have these conversations. What do we do? What does it look like? Yeah. How do we have the conversation? So we're going to do it today. We're going to have the conversations, and hopefully I can do the best I can do, right? That's all we can do. Right? Okay, so let's talk a little bit about it. The creators have come under fire about the series, kind of come under pressure, because they've depicted suicide in a graphic way. And also they've been under some scrutiny because the people have said they're kind of romanticizing suicide. And then we'll get into some other issues that the series portrays. Let's talk a little bit about that and kind of what your thoughts are on those issues.
So starting off with maybe what would be helpful first to kind of dive into.
Talking about the show,
sort of the scope of maybe the romanticizing of a suicide. So I would say that yes, it is definitely, they show how the young person dies by suicide in the series. I think that that's something that if students or children are going to be watching, they're going to be watching with supervision, and it's going to be part of a larger conversation that parents hopefully are going to be having with their child. But I would say that parents should know that that is actually showed, so I'm glad that you brought that up. As far as romanticizing, I would say that I don't come from a Hollywood background in any way or a film background, but I think that there's probably, if we look back in history, always examples of that in a lot of different, maybe even really famous films that we saw, or famous series that we've seen over the scope of just media and television and production. So I don't think that this is any different than that, but I think because it has to do with youth specifically and a very tragic, traumatic way of dying, maybe there's more of a scope on that. But I feel like the romanticizing part, and again, this is just my opinion and this is not the field's position, might actually sometimes bring more attention to a topic versus if it's just kind of glossed over. So the Hollywoodness of it might actually be helping because it's bringing more attention. Now again, that might not be true, but that's just, we wouldn't be having this conversation, I don't think, if it didn't entail all those different kind of visuals. And then of course, the risk factors that I think we're going to delve into a little bit more, where it's not just suicide. There's bullying, there's violence, there's interpersonal violence, there's sexual assault, family stressors, relationship stressors. A few of the characters are in a process of coming out in the community and also to their family. So there's a lot of different things. It's not just suicide.
Exactly. There are multiple things happening in this show. That is a lot to take in as an adult, right, let alone a teenager.
You actually bring up a really good point, and I wanted to say that I don't know about you, but at least for me, when I was watching it, this isn't about me, it's about youth, but parents or adults that might be watching this, especially if you're watching it, hopefully you're watching it alone first and then making a decision about the youth watching it in your life. There are going to be things that are going to come up for you that might actually be triggers. Maybe you personally have had experience with substance use or an abuse, or growing up in a substance using home, or you yourself have been a victim or a survivor of sexual assault at some point in your life, or maybe you flash back and those things actually happened when you were in high school. So I would say that one of the number one things that we're telling people is, if you are going to watch the series, there's that philosophy of binge watching. I would say it is not recommended, especially for adults and for youth. Take a break. I think I even might have given you the suggestion, take a break in between episodes. Go for a walk, go out for a meal, do something where you're kind of you're giving your mind an emotional break from that topic, because it is really serious and there's compounded experiences that people have that you might have your own connection with. So we don't want to traumatize you, the viewer, but we want you to, obviously view it, but just like anything else, you should probably take your time.
And I think it's so important to realize that it can be, even though it's made for teenagers, you even said to me, it's kind of scripted so that it's engaging and curious, but we all have that binge mentality when it comes to, especially with Netflix, because it's all available. Taking a break. I'm going to have you scoot over just a little bit so we can see you. So let's talk about this. You mentioned if you are an adult and if your kids are talking about it, do you think that kids should be watching this? Do you think that kids should be watching this? And if they are and they're talking about it, should parents be talking to them? Should they be watching it on their own?
So I think that, first of all, you ask your child if this is something that's been talked about. I wouldn't assume in any way that your child even knows what this is, especially elementary school and maybe going into middle school. So if your middle school child actually has older siblings, there's a chance that maybe they have had some exposure to it. But I would not assume that your child knows anything about the series. So First of all, asking them. So I watched this Facebook Live, Go Local Prov Live interview today, and they were talking about 13 Reasons Why. Is that something that you and your friends have been talking about? Have you heard about it? And then give your child an opportunity to say yes. Take a breath and listen to what they're about to share, because they might actually have not seen it, or their friends really haven't, but they're getting bits of information. Okay. So I had someone in my life last week that said, "Oh yeah, I asked my 7th grader if they've watched it, and they said, 'Oh yeah, Mom,' but they don't show any graphic details. They don't show Hannah, the character, dying or anything like that." Well, that's actually not true. So it was interesting that child was getting sort of secondhand information. So I would say, first of all, ask your child if this is something that their friends or have been talking about at school or even outside of school. I know for some students, at least for me, I learned about it just before April vacation. So that's actually when I started watching it, and I have a feeling that there might have been other families that were starting, maybe they didn't have something to do on April vacation, so they said, hey, let's just start watching this series. So there might have been a lot of people that came back from school vacation, and that's why myself and my colleagues have been getting more calls about, hey, they're starting to talk about it in health classes, in the hallways. One of the things I heard from an educator the other day, I was in Exeter, West Greenwich, they said that students had started to quote lines from it. So they had actually, taken on some of the characters and said, remember when Clay said, and then started quoting. So that was really interesting.
Like in the school, or like for class, or they were
kind of quoting, what had been said, and they were identifying with certain characters. Okay. So that was it. So not only were they watching it, but they're retaining it enough where, we all know a lot of different films where you memorize some of the lines to it. And so that was really interesting to me that they were quoting it or referencing certain. And then as far as watching it, I would say that if you do make a decision that you want your child to view this, absolutely with supervision, I would absolutely not recommend, if you have a child who has recently had a suicide attempt, if they are being treated for a serious mental health issue like depression, major depressive disorder, anxiety, schizophrenia, bipolar disorder, a number of different disorders that this might not be really appropriate for them because they're already very vulnerable. So we have been making the recommendation that young people and children who are already experiencing these types of things probably are not the population that they even as the producers wanted the students to be watching. So,
okay.
But if you are going to have your child watch it, do it with supervision, watch it first as much as you can, take breaks in between, or maybe you watch 3 episodes and then you supervise with your child and you watch another 3 and you take breaks, but you don't do, you don't plan a family evening of watching all 13 episodes, or that's definitely not what we're recommending, because at the end of the day, these are all supposed to have conversations built into them. So you're not going to sit there for 13 hours, maybe, over a couple days and then just be quiet. There's, check in with your child. Say, you know what, that episode was really powerful. Like, what were some of the things that resonated with you? And then sit back and listen. I think sometimes adults, we mean well, but we want to provide a solution and we want to prevent our kids from experiencing pain. So we kind of jump right in with, this is how you should react, or this is how you should process this, or this is, no, don't worry about that, that's not you. But what we are saying is sit back and listen, because that's where you're going to get a lot of really rich information about how your child is reacting to these issues.
Okay. So let's talk a little bit about some of what's happening here, because we're looking at it's suicide. This is what it's focused around. So the whole premise of the show is 13 reasons why this youth committed suicide, and she recorded on tapes and then sent the tapes after she committed suicide. So let's talk about the issue, what you deal with in your job and what we're dealing with here in Rhode Island, and what we can do to prevent this from happening to youth and to children in our area, because we need to look for warning signs and we need to look for things. So let's talk about this in general.
Okay.
So maybe we can start off by just what's happening on the national level, and then we can talk about what the work is happening here in Rhode Island.
Okay, on the national level, so one of the things so I work for an agency called Rhode Island Student Assistance Services, which you had mentioned earlier. We are a prevention organization when it comes to youth substance use and abuse, or we support students in 42 schools, mainly middle school and high schools within Rhode Island, and we have a very strong presence in Providence, actually. Our agency has been around for 30 years, and we support students through evidence-based programming called the Prevention Education Series. So we give youth information about risk factors and then how to cope with those risk factors.
Okay, great.
Maybe their own substance use or abuse, or their curiosity about that, or they're coming from a family that uses and abuses alcohol or other substances. And then also so as far as that, our agency actually works with the Department of Health. We're funded by the Department of Health to do this piece, which is the youth suicide prevention programming.
Yeah.
So what that means is that there are designated schools within the state that have, through the grant funding, through SAMHSA, which is our National Suicide Prevention Lifeline funder, Substance Abuse and Mental Health Services Administration. So it's a lot of acronyms, but so the federal government in 2005 passed in the Garrett Lee Smith Memorial Act. So there was a young person, his dad actually had been in Congress, and he died by suicide, and he was in college, and that was Garrett Smith. So they passed that legislation which allowed states to apply for these monies to be able to do the prevention work. So that's how it kind of filters down. And then on the state level, what we're doing is, and I'm glad you used the word prevention because we are very focused on prevention, is being in at the school level with training adults, educators, crisis support team members, which for anyone who's watching is usually someone within your child's school that's either a school social worker, student assistance counselor, school psychologist, possibly the nurse at the school, guidance counselors, administrators, and then there's also other support folks like behavioral specialists and people's special educators that could be part of this. They're trained in something called the Suicide Prevention Initiative as part of this grant, and they receive something called QPR, which is a very basic intervention, very similar to CPR, on how to question a youth if they're thinking about suicide, persuade them to get help, and refer. And then the other piece of that is that we actually train those support staff folks on a clinical tool called the Columbia Suicide Prevention Rating Scale. And what that, the Columbia Suicide Severity Rating Scale, the CSSRS, that's 6 basic questions on how to ask a youth if they are suicidal, if they have any intent, if they have a plan, if they've already thought about how they would kill themselves, what that would look like, have they ever thought about dying by suicide. So that's a very powerful question, as you can imagine. There might be a high school student who, when they were in middle school, actually had made an attempt or had thoughts. So we train these folks on how to ask these questions. So ideally, there's a faculty member in a school, a teacher, maybe a cafeteria worker, or somebody, even the custodial staff or the front office staff of a school, and they're recognizing that there's been a change in a student. So we're empowering them to bring that student, get them connected with the support team who's now going to ask these questions. Now, if you're a parent, you're probably asking, well, what happens when my child might or might not say yes or no to some of these questions?
Yeah, if they lie, they're
typically they're being very, so the myth is that if you ask somebody if they're thinking about killing themselves, that you're going to raise their threat level. The truth is that you actually dramatically reduce their threat level just by asking.
Okay.
So you're getting answers from these students. You're also sending a message that this is pretty serious stuff, and that you're going to take that seriously, whatever their answers are, and that you're in it with them to support them and get them help. Obviously, there are some students who might be struggling with lots of different things, but they're not actively suicidal. They're going to tell you that. Students really enjoy telling adults when they're wrong, or when we're making a big deal out of something that's, they feel is very small. So we usually get that information as part of that kind of interview. And then what happens is that there's something called Kids Link, which is a part of Bradley Access Center, which is part of Bradley Hospital. And what those folks are, they have a hotline. And so parents or educators actually have a resource. It's not billed to their insurance. It's 24 hours a day. There's a clinician that actually answers the phone, and they can actually kind of triage over the phone. My son or daughter is experiencing X, Y, and Z. They shared this with me today. Or the school psychologist or social worker is calling and saying, hi, I'm calling from Central High School or Classical High School or Hope High School in Providence. I have a student I'm very concerned about. And then over the phone, they're doing that consultation. And then from there, that child might need a same-day assessment, which just means that they're going to, have a clinician talk to them a little bit more in depth about what they might be experiencing. Or if it's a crisis and it's actually imminent, they might actually be going to a local critical care, like they might be going to Hasbro and transported directly from the school.
Right away.
Or there might be circumstances where a child is already hooked up with a clinician or a counselor, a therapist, and they just need some extra support. And maybe they need to go 1 or more times that week because they're going through something. So there's all different levels. We just want to divert parents from having unnecessary long waits in an emergency department where they really don't need to be there because that's not the appropriate level of care for their child. We want to get them where they're actually supposed to be to get that help sooner rather than later.
I like that. And how crucial is it for parents, for friends, for educators, for someone to step up and make that contact? Because if you're seen in the show, maybe people aren't making that initial step.
Right. So what we actually teach when I'm doing trainings, I talk about connectedness. And so, maybe I notice something about you that's a little different on a Monday morning, and I just say, oh, maybe that's just Molly, maybe she stayed up late, watching something, or, but then I notice it goes on for a couple days, but I'm not asking anyone else if they're noticing anything different.
Okay.
So it's really important to also have conversations with other people if you feel like there's a change in a child or in somebody in general, and be empowered to talk about it. So that's what we actually tell people to do. So your question was how important is it? It's critical. It's critical to act. So we teach kids how to act, acknowledge that their friend is struggling, show care and concern for them, and then to tell an adult and get their friend. Or in some cases, this actually happened the other day. I was teaching in a school and I said, all right, so let's just stop right here. Acknowledge, care, tell. It was actually at the Met.
Act.
Acknowledge, care, tell. What if you don't really like the person? Can you still do the C? And this one student raised his hand and he said, yeah, it's just the right thing to do, miss. And it was great because it was the perfect answer. He said, I might not like that kid, but I don't want him dead. And I was like, Thank you.
That chokes me up.
So it was very sweet because I think we are modeling that you're not always going to like everyone. You're not always going to be friends with everyone. Yeah. But the right thing to do is to get them help. You don't need to be the person, to stay in their life and be best friends, but you are saving a life.
Okay, that's so well said. Just kind of as we wrap up here, can you tell me what are some of the warning signs? And you kind of hinted on some of them. What are kind of some warning signs that friends, educators, and family members should look for if teens or youth, or really anybody, seems to be struggling, if they're depressed or if they are suicidal?
Yeah, and we focus a lot on that. So I would say the series itself, we talked a little bit about some of the things that were showing up with some of the adolescents that were depicted in the series. So there might be a child that might be in a coming out or questioning process and they're not being supported. That could absolutely be a risk factor, a warning sign. Maybe a student who is really withdrawing from things that they normally used to really like to do. That could be virtual world or in person. Somebody who has an increase in their appetite or has a loss of appetite. Someone whose mood is definitely changing. Now, for parents out there, you're going to say, well, that's normal adolescent development. But your child has their own norms with their moods, and we're looking for changes in that. We're also looking for things like apathy, anger, people who are normally pretty happy and now they are just very, very sad and very emotional. And we're looking for people who have also experienced traumatic loss or just loss in general or compounded loss. This is the #1 time of year for suicide in this country is the springtime. So there is a big myth that it's in the holiday season. It is not. It is right now. And for our youth specifically, the amount of stress that they have in the spring between graduation, academic stress, social stress, sometimes athletic stress, performance stress, peer stress, whether or not they're going to have a summer job or something to do in the summer, structured environment they're going to. It's layers and layers and layers of stress. And then the other risk factor is if, and we didn't mention this earlier, but if there is a young person who has experienced trauma like sexual assault, or they say the word rape in the film or in the series, definitely don't recommend that they watch that series. Can trigger a lot of the trauma that they maybe didn't get help for at this point. But anybody who has had any kind of physical, emotional, sexual abuse is absolutely a risk factor or a warning sign. So all of these things, sometimes our students don't come in with a tattoo on their head saying they're suicidal or they don't say it, but based on some of their life circumstances, kind of like what we saw with Hannah and the character in the series, we might be able to piece together that is definitely a student that should be on our radar.
Okay. Leigh, thank you so much for coming in and helping us have this discussion, a critical discussion to have, a difficult one to have.
It is.
But I think more important, something I was surprised to learn, suicide, the second most leading cause of death for the ages 15 to 24, preventable. And so we want to see this issue not be an issue.
And prevention starts with conversations and continued conversations, so thank you.
So thank you so much for having us. Again, if you or someone you know needs help, needs someone to talk to, we do have the National Suicide Prevention Lifeline on our Facebook page. You can call, you can text. So please, if you know someone that needs help or just need someone to talk to, please reach out. We want to make this prevention possible.
Thank you, Molly.
Thank you so much for coming in. We really appreciate it.